So vaccines are a critical factor in eradicating many common vaccine preventable diseases. So due to temperature control requirements for vaccines, cold chain storage errors result in revaccination, which we've seen a lot of down south. It's significant financial loss, disposal of vaccine products. So failure to store vaccines properly can reduce vaccine potency, as Abigail, yes, as you said before. And then you risk patients receiving ineffective health products, resulting in inadequate immune responses, and then also distrust, which there's a lot of at the moment. They're also expensive and can be in short supply. I was reading the other day that known cold chain breaches are estimated to cost the Australian health system about $5 million in replacement a year. And in the last 5 years, there have been 12,000 cold chain breaches in Australia, and that's about 750,000 destroyed vaccines. So we freaked out when we got 30. So, so as I was saying, not too cold, not too hot, not too bright. This is our chain that we talk about. So as soon as the vaccine is made, and then it's distributed through the facilities into the hospitals, health centres, however it gets there, and then as soon as it goes into the arm, that's cold chain. So we use, and you use, purpose-built vaccine fridges. They are what we have to use now because they're designed and constructed specifically for the vaccine storage. For mobile and outreach immunisation clinics, which we do have an outreach team with us, they can be transported in feeds, which is what you'll be receiving. So we will go through how to pack those to keep them. And they're not for long-term storage either. I think it's about 8 hours or so. So you would all be familiar with the national guidelines, Strive for 5. They don't send them out in hard copy anymore, but I think you can still actually just email and request them because I like them in a hard copy. So cold chain management, you all know about it, you've read about it, it hasn't actually changed at all, but what does change is people, the equipment and the technology. So I think everybody in here's probably got a different data logger, and then you call us and you're like, my data logger, and so we have to look stuff up as well. And then all of your fridges will be different. People, the high rotation of nurses who will go through each clinic, and that's where we'll talk a little bit about VMP a little bit later as well. So we've just covered, we're going to talk a little bit more about vaccine fridges and data loggers, and with your VMPs, because we've, especially after this cold chain, I'm going to call it a cold chain outbreak. All of this, everybody's been looking at their VMPs, and so just getting to know, Sally hasn't been here for 5 years, perhaps we need to go through our cold chain management stuff again. Then looking at, that you are familiar with all of your data loggers, with all of your equipment, and then that there are plans for when you have a power outage, which is unplanned, which a lot of places their UPS did kick in, but some places didn't. And so just having backup and process and who's in charge of what. Because if we don't look after vaccines, then we could have a spike in diseases that don't actually exist in Australia at this point. So we thank you all for doing all of that. And
yeah, thanks, Sarah. So I'm Catherine, so I'm just going to follow on from what Sarah was discussing, and just more about the guidelines. So in the national guidelines, there is a requirement for each vaccine service provider to supply us with a VMP. Okay, so it tells us how you manage your practice in cold chain on a day-to-day basis with reference to the ordering, handling and restocking, your equipment, how it works and who looks after it. It also explains what your practice would do in the event of any cold chain breaches and how your staff education is organised in your practice. So your VMP does need to be reviewed every 2 years and updated with us. Ideally, we like them to be updated if there's any changes to your cold chain practice. So if you get a new fridge, that's something that needs to be updated in your VMP. Also, if there's any cold chain breaches, we do ask you to have a look at your VMP at that time as well. So how do we achieve our goals of safe vaccine management? We use the purpose-built vaccine refrigerators. So we don't use bar or domestic fridges as they can't maintain a stable temperature. Okay, the temperatures vary quite widely in the domestic fridges and between each shelf. So how do we achieve safe vaccine storage? We use the open plastic weave baskets on the shelving. They allow the air to circulate between the vaccines. As Sarah mentioned, all of the vaccines are to stay in their original packaging. They're not to be decanted to save on room. And it's not for storing any pathology or food. Okay. So some of the new fridges will come with the data loggers, and some of them have the cloud monitoring as well. It will just depend on what technology your practice has. But the important thing is to know your fridge and its limits, and especially when you're ordering during flu season, not to order too many vaccines that aren't going to be able to fit in your fridge. So how do we check on our procedures? So the annual cold chain audits for your fridge can be found in the Strive for 5 booklet. And these can be found online, or you can order those through Quip. We keep temperature charts so that you can keep an eye on those temps twice a day, knowing that your vaccines are viable. Okay. There is online training available for cold chain on the Queensland Health Immunisation page, and this applies to admin staff as well as clinical staff, and you can select your discipline when you enrol in the training. So if you have quite a lot of new staff, and for example, if the admin staff may be there on days when there's no nursing staff who will be receiving vaccines, this would be really good education for them to do. Okay. Yes. So the monitoring and recording of your vaccine fridge temps, this needs to be done manually twice a day, and these hard copies need to be kept for 10 years. Okay, even if you have a data logger, you still need to keep the twice daily min-max recordings. Those still need to be done. With your data logger, it's important you know how to read it and where the data is stored and who that person is responsible for that data. Because in the event of a cold chain breach, that's what we will need, okay, to be able to determine which vaccines are able to be kept or discarded. So the min-max temp charts, there's a couple of examples there. So there's the Queensland version up the top and the NIP version down the bottom. They both do the exact same thing. So the important thing, and we have seen this in a couple of practices where they have run out of the min-max temp chart and they photocopy it, but they only photocopy one side. So it's really important that the other side that I will show you, that's on the next slide, sorry, I'll go back here. So there is a flip side as well. So you can just order these temp charts with your vaccine orders. If you put a note there with the email, then you will be able to order these charts as well. So there's just an example here. So we can see that somebody has come in after the weekend, and when they've done the min-max, they can see a temperature of 13 degrees there. So on the other side of the min-max temp recording is the vaccine storage troubleshoot section. So up the top there we've got, as an example, the 5th of September 2022, where the nurses come in after the weekend and found that the fridge temps went up to 13. So what the nurse did was quarantined the fridge and notified public health until further advice. What may have happened is that on the 2nd, on the Friday, was at 5:30. And if we go back here, the min-max was done at 4 p.m. And then at 5:30, the fridge door was accidentally left open, making it alarm, but then the door was closed and the temps went back down to less than 8 within 15 minutes. So there was nothing further to do. Education reminder was given to staff, and nothing else was needed to be done. So this is a communication tool for everybody to use, and it can avoid potentially cancelling appointments and discarding vaccines. Okay. So if you do need any more of these charts, make sure you do request them with your orders. I'll hand over to Kathy now.
Hello all, as I said, my name's Kathy. You can hear me okay? Now, our whole plan was for us each to do a little bit of talk so you don't go to sleep and we keep you on your toes. And as I mentioned, we're not tech savvy, so just bear with us with the buttons. Was it just the up and down ones to push? Yeah, that one, so just push that one. Yep, beautiful. So I'm just going to briefly talk on data loggers. As was mentioned before, there's many data loggers. We're not experts, we know some of them. You probably know more of them because in the last few years, hasn't there been lots that have flooded the market? They've become a lot cheaper, but gosh, aren't they good? They are so good. So as Catherine mentioned, when we have a cold chain breach, it really helps. And in the Strive for 5 now, they actually do say a data logger is required. With certain fridges, it's no doubt, and that's the quirks, the ones that don't do a lag temperature. But we do still have some practices that don't use the data loggers. When there is a cold chain breach, we really encourage it because it's easy for you, it's easy for us. And I'll explain that at the end here about what our practices have changed slightly with the cold chain breach management. And what are really good are some of the cloud-based ones. So with the cloud-based ones, you can set them up where they automatically download every 5 to 10 minutes to a spreadsheet, send you alerts via a phone when it's up above or down below or when power goes out. So there is a lot of technology and we're moving every day, and it is about making your life easier and our life easier. Now, data loggers also need to be calibrated according to the manufacturer's guidelines. Usually this is each year. Along with that, so you can put that along with your maintenance schedule. Also, batteries will need to be changed. Usually about one every 12 months, we say. Sometimes if you've got a really flash one, as I got told the other day during this event of cold chains, oh, our one tells us when it's due to be changed, and that's even better because it kind of flashes and alerts and tells you. So just something to know, and it's good. Better push the button. Too busy yapping. Okay, so when to download? Now, as I said, the min-max, you can read them on most of the fridges. And remember, most of those fridges, those min-maxes on the outside, is at ambient temperature. So that's great for just a visual cue. What we love about data loggers is it's reading the lagged temp, and really that is equivalent to what that vaccine solution is. And that's what's important. This is what we've discovered over the years with a lot of information, a lot of data, is that it's about that liquid inside that vaccine. So as we say, that needs to be recorded twice a day. Now, what we usually say for the data logger, unless it's a Quirks fridge, they usually just need to be downloaded once a week and saved electronically. Also, I do believe some of the data loggers have a limit of what they will store. So if you don't download them weekly and it's suddenly a month later, you will lose some data. And that's not nice for us. When a cold chain happens, we'll just say that gives us a lot of strife. And also for you, because it's hard and it's tough. As I said, with the vaccine fridges that don't have a minimum max, you do have to sometimes download that data logger. The newer ones, as I said, you can set up so it's done automatically for you. And we do have to store the data, as we said. And here's just an example. This is a really old one, and you probably won't see many, but who knows? Some vaccines fridges live forever. So some of them don't have it, and some of them have those old wheels and everything. We are really encouraging anyone without a min-max is to have a data logger inside or have a min-max thermometer. And I know some of you already do that. And here's another fridge, which the Quirks MediSafe. This fridge is apparently really good. It's economic. In other words, it's a great price for what you get. So we do find a lot of the practices do have these. And thank goodness now they all nearly come in with an inbuilt data logger, or we all put one in easily. And hopefully most of you have got that data logger that automatically downloads for you. Otherwise, you do have to manually do it morning and night. Because as we said, the one on the top is the ambient, the data logger is lagged, and that's what's most important. So lagged means it's, you know, when you open a fridge door, what happens? Hot air rushes in, doesn't it? And it goes around and it warms and your temp goes up very quickly. But that little vaccine that's sitting in there, that won't get warm straight away. It needs that door to be open and that temperature to be warm for a while to become warm. Does that make sense? So that's the lagged. And most of these data loggers have, you know, sometimes you might see them like this one here. Can you see me pointing? Oh, here. That one there on the end. It's in a solution because that solution is meant to be the same as a vaccine. Does that make sense? So that's where it's taking the lag temperature, because the air will get warm quickly, but to go through that vial, it takes longer. So you will notice if you have a Quirks, you know, you look at your Minimax, when you see a cold chain breach and then you see what your data logger, what's lower? Data logger, perfect. And that's what's so true, because that's what the vaccine's actually gone through, not what the air around the fridge is. Does that sort of make sense? Does that answer your question? And I should have thought of that. Because remember, it is about making and keeping that vaccine viable and the best conditions so it actually does what it's been made to do. Now, and this is probably telling you just things that are simple, but how do you read a Minimax thermometer? I know Whip used to supply these years ago, and they supplied very basic ones. And they did, I think, about 3 years ago, but excuse my memory because COVID and on top of last week killed my brain. But they did supply these new ones that do have the Minimax and the current. So it is important to have all three of these temps. If your fridge doesn't have one where you can see the Minimax and what the current is, you need to have one of these, or else you have your data logger. The reason to have this little one is to download your data logger, you've got to go somewhere else, or you've got to go on your phone to look at the result. This will tell you very quickly before you go to give a vaccine that your fridge is in range. So it's very, very easy. It's a very simple visual tool, and it just makes life a bit easier for all of you. Just making sure I don't forget anything. Now, this is a question. What if it all goes wrong? As we've already mentioned on in your VMP, you've got a backup plan, and I know you all do. And this is a good time to get refreshed. I'm sure some of you are already involved in that last week, which was just sudden, but you need ESCIs, which will show you a great ESCI. The ESCI needs to be monitored. And if you have a data logger that you can take out, guess what you do when you put your vaccines in that little ESCI? Put your data logger in. And just note on the time on your sheet that you've taken it out, because you may have, you know, no one's Speedy Gonzalez. We've had a few doctors with, not in Townsville, who have had cold chain breach, and they've got those vaccines out of the fridge into a cooled ESCI in 5 minutes. Is that achievable, anyone? No. Which I should tell you about a doctor we had last week in that cold chain breach. He was very good, but he froze them because the power came back on. But So we know that it takes time. We know if it's planned, you can be organised. You can have that esky ready. You can have your ice bricks cooling it down. You can have your temperature ready to go. But if it's not planned, it's really hard, and you're sweating. And then even when it's at the right temperature, to get those vaccines in quickly and keep that temperature, you are going to have a little bit of up and down. So don't stress. Just do the best you can. Another thing to look up now and plan for the wet season, because it's coming to cyclone. Mind you, it's going to be dry, so we probably won't see any, is looking about where else you could store it when something goes wrong. So that could be your chemist next door who has backup power, or sometimes in the rural hospital pharmacies, like the main pharmacies, sometimes. And look, it's just about making sure in that BMP you have it clearly written where your eskies are, where the ice packs are, where your min-max thermometers. Make sure your batteries are ready to go. What we do with our spare ones, we put them in upside down so they don't go flat, because you haven't used it for a year. You can quickly flick it over. Just make sure people know that it's there and have some spare ones, because especially if it's unplanned, it is quite stressful. And this goes into, as you say, our preparing for storm season. So if you've got generators, you uninterrupted power backup, they are a lot cheaper. And we do know during COVID, a lot of practices got money and they have gone to the generators and the backup battery powers. Because as we said last week, we know all of Townsville lost power. And we were glad, because I think Stephen asked me today, he just wanted an idea of how many BSPs we have in the area. And so we only had, it was about 35, wasn't it? And I think it's about 70, 80, 90 with pharmacies, because we've got pharmacies on board now. So that means at least 2/3 had generator, which is fantastic, but we know all your practices aren't quite that lucky. So this is a good time to get ready, to check your alarms, just make sure everyone knows what to do, what's their plan, what's their role in all of this, and just get ready. And it was scary last week, I reckon, for us more than anyone, because it happened in the middle of the night when no one had warning, and probably most people like me woke up at 5 in the morning thinking, oh, power's been off. So things do happen. And obviously with that planned power outage, we expect you to be all over. Easy to do, easy to prepare, but we do have events like 2 weeks ago, or the nightmare time, power goes out. We're used to that from years ago with our storms, but we haven't had as many cyclones come through. But that was a bit of a shock to us.
Should Ergon supply them with a generator die?
No. So I think when you sign up to be a vaccine service provider, that you sign to say that you will have a backup plan, that you will be prepared for when the power will go out, either expected or unexpected. So that's why we do these talks, just to remind you. And when there has been a power outage, sometimes we will have that discussion. We're happy to have it with the practice managers or the people who hold the money, because sometimes it is very expensive, but then we say to them, you need to look after those vaccines. You need to make sure your vaccines are given. The least we want is that cold chain breach is reported, and we discard on caution, but we would love everyone to have either a plan or, as you say, backup generators or an uninterrupted battery supply, because let's make it easier for everyone. Does that make sense?
But what's my window? Like if it's in the middle, because I'm half an hour, 40 minutes away.
Exactly. I was just going to mention that, because that's a big dilemma. So what in our BMP, and excuse me because I'm not over familiar with the new tool, but I don't think it's got it in there, hasn't it? Oh, what about, we used to have the old one that we would like you all to know with your fridges, and it's good to know how long will that temperature stay in range when the power goes out. We'll say actually it's about half an hour. So power's out, your fridge will be at 8 and half an hour. If you're lucky, 40 minutes, and then it starts to rise slowly. So that's your sort of window. Now, we have changed our approach to cold chain breaches. It's been done with, we've had updated thermostability of vaccines. So we actually call any cold chain breach now anything over 8 more than 15 minutes, with stocking, restocking. If you take 20, that's okay. It's from that. Now, the reason we do everything over 8 is we take the cold chain breaches on what we call cumulative time. So, we'll ask you, we need that data logger, because we sit there and count the hours and minutes, and we count them on subsequent breaches. So last week we had a lot of first time, we had a lot of second. So it was an hour and a half plus 1 hour. And we worked out the temperatures. We always go the highest, but it makes a difference because we now have access to Sanofi. Remember Sanofi, the Adacel, Active, Quadracel, is it? Ovasalis, iPol. Remember, say 2 years ago, if you had a cold chain breach, what did we throw? We threw all of them if it was over 12. And we used to call a low, if it was under 12, we'd say just use the vaccines, it's fine. But we actually just take a different approach because we've got the true access to the true data now. And with our recent one, the vaccine that we threw was none of those. And we get on site and we do Sanofi stuff. We have to ring them for the 2 breaches. The vaccine we threw out was Varavax, wasn't it? Varavax. And a couple of other ones with 2-time breaches. But we were stunned because it's the first time we've done a lot of cold chain breaches because we haven't had a lot of power outage. So the way we do it now is slightly different. So just think of anything over 8. The outcome of it's under 10 is usually keep going, except for Varavax. That does not tolerate a cold chain breach, full stop, for more. I think it's over 8 degrees for 15 minutes. So it does not like to be outside. That's the only one. But the rest are really hardy. It's just a process. We'll clean it all up. We'll say carry on, keep going. So obviously, if you do have a cold chain breach, remember, unfortunately, you've got to go online, fill that form in. But we're happy with you to fill that form in. We are really, really happy for you to CC us, and you all know our email address. Or if you don't have to. And if you do send them a copy of your vaccines, we'll always want a copy of your vaccines in your fridge. And easiest way we say is on the order form. We do want a copy of your downloaded data log attempts from before and after. If you attach those, CC them in. Quip don't always send those on to us. But that's the 2 things that we really want. And obviously quarantine your vaccines, put the sign up, do that to Quip. We're happy for you to ring us then, even if Quip haven't sent it to us, because sometimes it's a bit slow. We can start going, okay, tell us the details. We'll have everything ready for when it comes through and we can just action it then. I think I'm getting, back. Yay, was there anything else from that?
I'm over to mouth now.
Okay. For those that don't know, you probably don't get me on the phone very much because I'm the outreach immunisation nurse, so I'm on the road a lot. But there are occasions when I do answer the phone when I'm in the office. So today we're just going to have a little bit of a look at how to pack a cooler. Obviously, this is something I do every day to go on the road and administer vaccines. So the soft pack bags are the ones that you will actually get once you fill out the evaluation at the end, which is this one.
That's right.
I might, just for time, not go through how to pack it exactly now. We could probably do that a little bit more at the end. But these soft pack bags are great because they have like a gel pack inside. So you don't really have to sweat the brick like you would do with other bricks. So they're awesome. Sorry. So they have these in them. But no, sorry, online we can't show you, but what you'll see, the picture that we see there are the bricks that need to be sweated, which is what we'll go through in a minute. But basically, it can be a little bit daunting when you have to pack an esky for the first time and you've never done it before, especially when you're in the dark. There's wind blowing. And all of that stuff. So sometimes it's good if you can do a little bit of like an in-service in your practice, just to have a little bit of a practice in terms of educating everybody on how to do it. And you can just keep some of the empty boxes and do like a little bit of an in-service in your practice. I've worked a long time in general practice, so we used to run those quite a bit, especially when we had new admin staff there, because they need to know what to do as much as you do. There's also some online training section, which I think the girls have already talked about, but there is on the online training section on Queensland Health, they have some videos on how to pack it. So it's very easy to follow. You just watch them and it will give you a bit of insight into what to do. I'm going backwards. It's good, Mel. So the bricks that were shown in the previous slide, they're the ones that you need to sweat. And sometimes you do not have a lot of time to do that because it can literally take hours for them to sweat. So there's a little bit of a trick where you can put them under some hot water just to kind of get rid of that iciness that occurs on the top of them, just trying to sweat them a little bit more. Yeah, kind of. I don't know if I'm brave enough to click the link there, so I'm just going to keep going. So these are the soft pack bags, and they are awesome. Honestly, we go out in all sorts of weather and they just maintain that temperature beautifully. So highly recommend. They're really easy to clean because they come all apart. You can flatten it down so the storage is much better when you've got like nowhere to put your eskies, which are these big, huge, bulky things. So really do recommend these bags. They're awesome. We have the cold chain failure, and that's repeated cold chain, which is kind of what Kathy was touching on with that cumulative time with the vaccines. It means that you have a negative effect on the potency of your product, which then means you've got a lot of phone calls to make to those people that have had vaccines administered that were not effective, not a very professional thing to happen. And there's already a lot of adversity with vaccines, as we know. So this is the online training that's free. Highly recommend it. It can, depending on how quickly you get through it, it doesn't take that long, an hour, maybe 2, depending on how slow you are to read. But yeah, they're great courses and anyone can do them. So highly recommend those. So just a little recap. We have that vaccines should be stored in their purpose-built fridge in their original packaging. So never take them out of their original packaging. Making sure that you are aware of your policies and procedures and your protocols. And another really good way of making sure you know that is by doing the in-service in your practice. Get everybody aware of it. Vaccine storage, the self-audit. So they don't take very long at all. And it's really quick and easy. You just go to your Strive for 5 book. It shows you exactly what to do. And just put it in your list to do every year. Also, another thing that you need to do is a slush test on your vaccine thermometers. So just making sure we check that daily temperature twice and we're recording it. And the prompt response to and reporting of your cold chain breach, and guidelines on packing and transportation of vaccines, and making sure that your equipment is well maintained, so having those services regularly, and just checking that all your alarms are working and all of that stuff. Yeah. Vaccines are expensive. So I have worked in practices where we've had a lot of travel medicine, and I cry when I used to have to ring up and say that all these thousands of dollars are down the drain. So making sure we have equipment that works and we know our process is really important, because we want to protect our babies and our adults, and we do not want to be the one on the end of that phone saying, I'm so sorry, you need to come and have that vaccine again. So we've touched on all the CCB stuff and we're just going to do a little bit about some updates for some vaccines because we get a lot of questions about this stuff too. So with the meningococcal B, we had a little bit of an update today saying that meningococcal B, the first ones that will have access to that is actually going to be the school-based programs. So the adolescents are going to be the ones that get access to Men B first next year.
Yes.
And was it around
Year 10.
February? Year 10. There you go. It's the age. Yeah. No, that's okay. Yeah. So it's the 15 to 19-year-olds. So if they're not in school, they're still eligible for that, but they're just going to be rolling it out in the schools. Yeah. And then the bubbies will come after that. So, and that's mainly because they only need the 2 doses for the adolescents. So everybody knows about Shingrix, I'm sure, but just to touch a little bit on that. So it's a non-live vaccine, which is why it's superior to your Zostavax, which was a live vaccine and had a very small amount of people that couldn't have it, those that were immunocompromised. So it's highly effective in the prevention against shingles or herpes zoster and its complications. And as we all know, the complications of the post-hepatic neuralgia. And it's also really, really effective in those as they get older as well, whereas Zostavax really wasn't that good in terms of protection with the older population. So this vaccine is far superior. It does need 2 doses, 2 to 6 months apart. So we would just recommend maybe do a 3 or 4 month recall for your patients, just to make sure they give them a bit of fudge factor with coming back in to get that second dose, because it is important they get that second dose because it will give them the better cover. Okay. And it can be used in immunocompromised as well as immunocompetent people. So however old they are. If they're 110, go for it. So if they bought their own Zostavax and they had their Zostavax themselves, like paid for that, they can have a Shingrix, funded Shingrix within 12 months of that dose. But if they had a funded Zostavax, they have to wait 5 years in order to get that free Shingrix. Yeah. Yeah.
Yes. And you're 65 to 70. Yeah.
Yeah.
They can get it straight away. They've had their, if they're 75, they should be able to get it straight away.
If it's been 5 years, yeah.
Yes. They've had it at 70. Right. So now
They're 75 now. Yeah, that's fine. Yeah.
they want over 75. Yeah.
Yep. Yeah. Yeah, 12 months. Yeah. So that was if there was an active case of shingles online, that you wait 12 months.
So look in the handbook. If that immunocompromised rules change because they are vulnerable, and you probably will be trained to wait 12 months for that vulnerable person to have
Yeah.
a case of shingles. So the time wait is short. I think it's only 2 months for the immunocompromised.
3 months.
3 months, sorry.
3 months, yeah, after the acute illness, if they're immunocompromised. Yeah. So they can receive the Shingrix 3 months for immunocompromised people only after an acute illness.
Yes.
Yeah. Yeah, is that all good, everyone? So we're nearly at the end. So we just wanted to touch a little bit on Vaxelis because that's come to light to us that there's a little bit of refusal going on with some parents in the community. There's a lot of chatter on social media And the main chatter is about the fact that if you have a look at the picture there, you'll see Hep B, and then it has rDNA after it. So we've had Child Health come to us last week and say that they've got mums refusing to have Vaxelis and they only want Infinirix Hexa. So we thought we'd bring it up in the meeting just to make you aware that this could come up in conversations with your parents soon. And we have had Dr. Donoghue look into this for us as well, and he's given a little bit of advice too. And he's just basically said that the PI is badly written, and that it lends itself to misinterpretation. When you compare it to the Hexa PI, it's confusing and could be easily misled by those that want to take it in that direction. So under the heading on the PI, Australian product information and name of vaccine, that's where it can lend itself to misinterpretation. So if you have a look at the PI when you get back to work and just familiarise yourself with that, both correct, yeah. So you can look at the TGA website to get that information. Both headings, under both headings, it says the components include Hep B, hepatitis B, rDNA in brackets. It is not specifying that the mRNA is the manufacturing process for the surface AG protein, and it is not a component of the vaccine. So it's how they've got that antigen into the vaccine. It is not DNA in the actual vaccine itself. It's extremely confusing. People don't understand the processing of vaccines. It's extremely scientific, so it can easily be misled. It's exactly the same process as Hexa. Yeah. So it's made exactly the same way. Yeah. But it's misleading because it has rDNA. Yeah. So unfortunately, because of this printing on the box, a lot of people have gotten hold of this information thinking there's some sort of thing that's going to change DNA, and that is not possible. So they're manufactured exactly the same way. The Hexa and the Vaxelis are exactly the same. Dr. Donoghue wanted to make sure that we kind of included this in our education tonight, because you're going to probably get this coming up very soon.
Thank you very much for joining.